All right, let's dive into something pretty incredible today. We're looking at a new study out of Stanford University that could totally flip the script on how we think about aging and joint pain. I mean, just imagine a world where we don't just put a Band-Aid on arthritis. What if we could actually reverse it?
And that brings us to the big, almost sci-fi question at the heart of all this. For literally millions of people, joint replacement surgery is kind of the last stop on a long, painful journey. But what if that whole journey just disappeared?
The villain in this story, of course, is osteoarthritis. You've probably heard of it, or maybe you know someone who deals with it. It's basically the wear and tear on our joints. Over the years, that protective cushion of cartilage that sits between our bones just breaks down. And that leads to pain, stiffness, and for a lot of folks, it really takes away their freedom to move.
You know, for decades, we've basically been playing defense. We manage the pain with pills and therapies, and then when it gets bad enough, we go in for surgery to replace the joint. But that's just dealing with the aftermath, right? It led scientists to ask a much more powerful question. Instead of just fixing the damage, could we stop it from happening in the first place? Or, and this is the really exciting part, could we actually reverse it?
So to answer a question like that, you have to play detective. You've got to find the root cause. And that's exactly what a team at Stanford University set out to do, to hunt down the specific cellular culprit that's actually driving this whole breakdown. And believe it or not, they found it. It looks like the main bad guy here is a single protein with the, let's just say, very catchy name, 15-PGDH. The key thing is, as we get older, our bodies just start making more and more of this stuff right in our joints.
So how does this whole thing work? Well, you can think of it like this vicious cycle. We age, our levels of this 15-PDGH protein go up, and this protein's job is to block our body's own natural repair crew, the molecules that are supposed to fix tissue and calm down inflammation. So with the repair team basically locked out of the job site, the cartilage just keeps wearing away.
Okay, so if this one protein is the villain, the multi-million-dollar question becomes, what happens when you stop it? What if you could just shut it down? Well, this is where the story gets really, really exciting. So here's what the Stanford team did. They took some older mice that already had worn-out cartilage in their knees, and they gave them a drug specifically designed to block that 15-PDH protein. The goal was pretty simple. Just flip the damage switch to off and see if the body's repair crew would get back to work.
And the results? They were absolutely remarkable. I mean, in the older mice, their worn-out cartilage actually started to get thicker and repair itself. Even crazier, they took younger mice that had an injury, and blocking the protein stopped arthritis from ever showing up. This wasn't just pausing the damage, it looked like they were actively reversing it.
And look, this wasn't just something they saw under a microscope. The mice themselves started acting like they were in less pain. Their movements got steadier, and they started putting more weight on their injured legs again. Those are huge signs that the treatment was having a real, functional impact.
Of course, mice are one thing, but the billion-dollar question is always, yeah, but will it work in people? So the team took that huge next step. They got cartilage samples from human patients who were literally undergoing knee replacement surgery, and they applied the same treatment.
And the result? It worked. The human tissue showed the exact same amazing effects. You could see clear signs that cartilage was starting to regrow, and the molecules that cause all that painful inflammation were way down. This was the moment of truth, the proof they needed. The lead scientist on the study, a microbiologist named Helen Blau, she really said it best. She said, imagine regrowing existing cartilage and avoiding joint replacement. I mean, that's the whole ballgame right there. We're not just talking about better pain meds, we're talking about making these huge surgeries unnecessary.
So let's zoom out for a second. What does all this mean for the future? Well, this discovery isn't happening in a vacuum. It's actually part of a huge wave of new thinking about how we treat diseases of aging.
And you know what's maybe the most elegant part of this whole thing? It's how simple the approach is. This doesn't require complicated and expensive stem cell therapies. It literally works by reprogramming the cartilage cells that are already there, waking them up, and just telling them to get back to their healthy, productive state. It's all about letting the body heal itself.
And like I said, the Stanford study isn't some lonely outlier. A recent study found that the active ingredient in Ozempic also seems to protect cartilage, completely separate from its weight loss effects. And at the same time, you've got researchers at the University of Colorado who are working on an injectable that might be able to reverse osteoarthritis in just a few weeks. It's clear a real revolution is brewing here.
So, after all these incredible results in the lab, where do we go from here? Well, the path forward is pretty clear, and it points directly to all of us.
to patients.
The next big hurdle for the Stanford team is to take this from the lab bench to the doctor's office. And that means it's time for full-scale clinical trials to prove that this treatment is both safe and effective in living, breathing human beings.
But get this, there's actually a huge head start here. It turns out a similar drug that also blocks this same 15-PGDH protein has already been through early safety trials for a totally different condition, and it passed with flying colors. No major red flags. That could potentially speed up the whole approval process by a lot.
So it all comes down to the one question that's on everyone's mind. How soon? And look, while it's impossible to put an exact date on the calendar, this research is a massive leap forward. It points to a future where getting older doesn't just automatically mean sore joints and chronic pain. A future where we're not just managing arthritis, we're curing it. The question is no longer if, but when.